Mr. President, it goes without saying that access to quality healthcare remains one of the pressing concerns that our countrymen face today. It is this reason that public health has been identified as one of the priorities by President Rodrigo Duterte during his 2019 State of the Nation address and in the development agenda of the country since our adoption of the Millennium Development Goals, MDGs. It is therefore my honor to present to you the proposed 2020 budget for the Department of Health and its attached agencies and corporations. Mr. President, for the Department of Health, we have increased the budget from 88.9 billion in the General Appropriations Bill to 96.3 billion in our committee report. The total new appropriations for the Department of Health and its attached agencies are broken down as follows. For the Office of the Secretary, 95 billion 897 million 787,000 pesos. For the National Nutrition Council, 461 million 33,000 pesos. For the attached corporations, the budgetary support to government corporations under the Department of Health is 76 billion 425 million 614,000 pesos. The substantial increase of 7.4 billion includes the allocation of additional 7 billion for the Human Resources for Health Deployment Program. This is to ensure the continued employment of our health workers whose services are badly needed in poor, underserved, and far-flung areas. At ayaw po nating mawalan ng trabaho ang mga nurses, doctors, midwives, at iba pang health workers. Other increases in the Department of Health budget are 350 million for the open defecation project to ensure sanitary conditions of those who still do not have toilet facilities. Then 6 million for public health management and 80 million for the Research Institute for Tropical Medicine. RITM has a valuable role in public health, especially in surveillance and control of disease outbreaks. For the budgetary support to PhilHealth, Mr. President, we have increased the subsidy for the premiums of indirect contributors from 67.3 billion to 72.3 billion. This is to support PhilHealth in the initial implementation of the Universal Health Care Act. As Chairman of the Committee on Health and Vice Chair of Finance handling their budget, I will defend and push for the much needed increase in the health budget, especially for our health workers who care for the sick. However, I would like to put it on record that although I am the sponsor of their budget, I will be the first to stand up and call out DOH if there are inefficiencies or irregularities in the spending of their budget. I will not hesitate to talk to the President if needed. Kahit ako ay nagdidepensa ng inyong budget, ako ang mauna ninyong mga kalaban kung may anomalya sa paggastos ng budget. Remember, zero tolerance si President Duterte sa korupsyon. Sa mga gumagawa ng korupsyon, there is no tomorrow. I also urge the DOH and other government agencies to ensure that every centavo of the people's money is put to good use, wisely spent, and used solely for the intended purpose. Dapat walang masayang ni piso. I call on our departments and agencies, including the DOH, to fully utilize and improve their efficiency in spending their budgets. Some of our colleagues initially signified their intention to interpolate, but in the interest of expediting the process, they have agreed not to interpolate on the condition that their individual concerns will be addressed by the DOH. I also ask the DOH to work on the concerns of our colleagues. And for the record, Mr. President, I refuse to answer any questions involving the actions of the previous administration and personal issues as I have no personal knowledge on those matters. Thank you, Mr. President. We are now ready to accept questions from our colleagues.